The first medication you are on is losartan. It's used for high blood pressure, which is also called hypertension. It's also used to prevent kidney disease in diabetic patients. Um, One of the complications of losartan is called angioedema, which is just painless swelling underneath the skin. It's very similar to hives. You had said that whenever you stood up, you get really, really dizzy, so that your doctor had changed the dosage of the medication. That's just called orthostatic hypotension, which is just a drop in your blood pressure, so just be careful whenever you stand up fast. Another side effect is just dizziness, lightheadedness, and you can take this medication with or without food. The second medication that you are on is levothyroxine. It's used for hypothyroidism. Um, Patients can actually be over medicated on this medication, so you need to watch out for symptoms of anxiety, fast heartbeat, chest pain, nervousness, tremors, cramping, heat intolerance, fever, and weight loss. Overtreatment of levothyroxine can cause atrial fibrillation, and you're at an increased risk for fractures. So you need to make sure that you get lab tests for thyroid hormones at least once a year. And you need to make sure that you take this medication on an empty stomach 30 to 60 minutes before breakfast. The third medication that you're on is atorvastatin. It's used for hypocholesterolemia. Um, there's two big side effects of this medication. The first one is hepatotoxicity, which is just toxic levels of the medication in your liver. So you need to make sure you observe for anorexia, vomiting, nausea, and jaundice. And jaundice is just yellowing of the eyes. You need to make sure that you have liver function tests completed every 6 months. The second complication of this medication is called myopathy, which is just a general term referring to a disease that affects muscles that control your voluntary movements. So just be cautious about new muscle aches, pain, and tenderness. And myopathy is actually an increased risk for individuals that have hypothyroidism. So make sure you take this medication at night, and you can take it with or without food. The fourth medication that you're on is montelukast, and it's actually an allergy preventative. There's only one side effect really, and it's depression, so just monitor for behavior changes, and you take this once a day at bedtime. The fifth medication is pantoprazole, and it's used to treat and prevent GERD. Respiratory infections like pneumonia is a complication of this medication. You have an increased risk of developing osteoporosis and fractures, so you need to make sure that you increase your calcium and vitamin D intake. Taking an antacid can manage the discomfort of rebound acid from the GERD. Hypomagnesia, which means basically low magnesium levels, is another side effect. So taking a magnesium supplement will help that side effect. It's really, really important to only use this medication for as long as you need, because it will increase the risk for osteoporosis. And it's also very important to not crush or chew tablets. And the last medication that you're on is Lispro or Humalog. This is a rapid-acting insulin used for diabetes. One of the main side effects of this medication is hypoglycemia, which is when your blood glucose is less than 70. If you are hypoglycemic and you are conscious, then you need to make sure that you have 15 grams of carbohydrates. Another side effect is hypokalemia, which is low potassium levels, and you can see hypokalemia for the side effect of muscle cramping. You need to make sure that you rotate your injection sites and allow 1 inch between the different sites each time that you inject the insulin. And another important tip for insulin is make sure that you store it properly. Unopened vials of single types of insulin can be stored in the refrigerator until the expiration date. Vials of pre-mixed insulins can be stored in the refrigerator for up to 3 months. And then the vial that's being used can be stored at room temperature, but just make sure that's not in sunlight and intense heat.